What is sleep apnea and what causes it? What can I do to avoid it, or reduce it? What are the easiest and cheapest option? Sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during sleep. The word apnea means the temporary cessation of breathing. You may be suffering from your partner's sleep apnea. There are two main types of sleep apnea: 1. Obstructive sleep apnea or OSA, and 2. Central sleep apnea. Obstructive sleep apnea (OSA). I will go through a summary first. Always consult your health care professional before making any changes to your medication or lifestyle. Obstructive sleep apnea is the more common type of sleep apnea. It occurs when the muscles at the back of the throat relax excessively, causing a partial or complete blockage of the airway. Causes are obesity, excess weight around the neck, having a large tongue, tonsils, or uvula, and a narrowed airway due to genetics can contribute to OSA. Central sleep apnea is less common and occurs when the brain fails to send the appropriate signals to the muscles that control breathing. Causes: heart failure, stroke, and certain medications can contribute to central sleep apnea. Symptoms of sleep apnea: loud snoring, often the most noticeable symptom. Pauses in breathing, witnessed by someone observing the person while they sleep. Excessive daytime sleepiness, feeling very tired during the day. Difficulty concentrating, problems with memory and focus. Irritability, mood changes and difficulty dealing with stress. What can you do to avoid or reduce sleep apnea? Lifestyle changes, weight loss. If overweight, losing even a small amount of weight can reduce the severity of sleep apnea. Positional therapy, sleeping on your side instead of your back, can help prevent the tongue and soft palate from collapsing into the throat. This may be the easiest and cheapest option. Avoid alcohol and sedatives. These substances relax the muscles in your throat, making it more likely for the airway to become blocked. Continuous positive airway pressure (CPAP) therapy. This involves wearing a mask over your nose or mouth while you sleep. The machine delivers a continuous flow of air, keeping the airway open. Surgery. In some cases, surgical procedures may be recommended to correct physical abnormalities that contribute to sleep apnea. Positional devices, devices that prevent you from sleeping on your back, promoting side sleeping. Treatment of nasal congestion, nasal decongestants or allergy medications can sometimes help if nasal congestion is contributing to the problem. It's crucial to consult with a healthcare professional for a proper diagnosis and personalized treatment plan. Untreated sleep apnea can lead to serious health issues, including high blood pressure, heart disease, diabetes, and daytime fatigue that can contribute to accidents. If you suspect you have sleep apnea or experience symptoms, seek medical advice promptly. Can sleeping on the side help it? Yes, sleeping on your side can often help reduce the severity of obstructive sleep apnea (OSA). When you sleep on your back, the force of gravity can cause your tongue and soft palate to collapse backward, partially or completely blocking your airway. This blockage is a common cause of snoring and contributes to the interruptions in breathing characteristic of sleep apnea. Sleeping on your side can help prevent this collapse, keeping the airway more open and reducing the likelihood of apneas, pauses in breathing. Here's how sleeping on your side can be beneficial for individuals with sleep apnea. Airway alignment. Sleeping on your side helps to keep the throat and tongue in a neutral position, preventing them from falling backward and obstructing the airway. Reduced snoring. Snoring is often a precursor to sleep apnea, and changing your sleep position can help minimize snoring. Side sleeping can decrease the vibrations in the throat that lead to snoring. Natural position for breathing. The natural alignment of the airway is better maintained when sleeping on your side, reducing the likelihood of airway obstruction. Tips for side sleeping: use pillows. Place a pillow between your legs to help keep your spine, hips, and pelvis aligned. This can make side sleeping more comfortable. Body pillow. A full-length body pillow can provide support and encourage side sleeping by preventing you from rolling onto your back during the night. Train yourself. If you're used to sleeping on your back, it may take some time to get used to side sleeping. Try using pillows or positional aids to gently encourage side sleeping. Mattress and pillow support – ensure that your mattress and pillows provide adequate support for side sleeping to maintain proper spinal alignment. While side sleeping can be beneficial, it's important to note that individual responses may vary. If you suspect you have sleep apnea or are experiencing symptoms, it's essential to consult with a healthcare professional. They can provide a comprehensive evaluation, diagnose the type and severity of sleep apnea, and recommend appropriate treatments, which may include lifestyle changes, positional therapy, or other interventions. Do not forget to click the like button and subscribe. Thanks very much for watching this video. Up above you see a video related to health. It will be more helpful to you and your family. Subscribe to my channel. See you in the next video.